So I'm now delighted to introduce Pippa Heylings, who has come to give our opening keynote. Thank you very much, Pippa. So many of you probably know, all of you probably know, Pippa is Member of Parliament for South Cambridgeshire and also Liberal Democrat spokesman for energy security and net zero. Pippa's dad was a GP, and Pippa from a young age supported him on his rounds and saw the importance of a strong, well-funded NHS and safety nets for the most vulnerable people in society. But Pippa has also spent 20 years working internationally to help reduce poverty and tackle climate change. Her career as a mediator has seen her work with national governments and the UN on some of the world's most complex environmental challenges. So as well as being our local MP, Pippa is really well positioned to speak to us at this conference today, given the theme of the conference. So Pippa, thank you.
Hello, and thank you for this huge opportunity and honour to open the 4th East of England Global Health Conference. I'd like to thank, obviously, Evelyn and Sarah as well for making it possible for me to be here. It really is an honour to speak today alongside some really influential experts and those of you in the room, and I'm sure they'll be providing powerful insights and hope, which is the most important thing for the future over the course of today. It's the biggest honour of my life to have been elected as the Member of Parliament for South Cambridgeshire. It wasn't in my life plan originally when I was working internationally, but things happen, and here I am. And I'm only at the beginning of my journey as a parliamentarian, given that I was just elected with the new intake of MPs in July. But I've dedicated the time since then to repaying, I hope, the faith that voters, the electorate communities have put in me, to deliver on the ambitious promises that I made, and those were about making sure that we rebuild the UK's leadership on the global stage in terms of climate change, because that soft power is critical not only to us, but to the many, many developing countries that I've been working in. And secondly, to fight for fairer funding for our primary healthcare services here in Cambridgeshire, and for our secondary care, for our new hospitals as well, and for social care, because that, in the Liberal Democrat, this is the area that we can't fix NHS until we fix social care, to make sure that is also there within the government agenda. And finally, it's about protecting the stunning natural environment that we have in South Cambridgeshire that is so critical, not only for nature itself, but for our own physical and mental well-being. And it's these 3 strands of my election campaigns which are central to my passions as a politician. And they reflect the theme of this conference. So thank you very much for the invitation, because I truly believe, and what I learned from many years working alongside incredible people internationally, was that we cannot tackle the climate crisis and public health crisis as separate things. They're completely interconnected. And I was proud to have used my maiden speech in Parliament to highlight this critical need for the UK to stop rowing back on our climate pledges and to regain that leadership with ambition in terms of our own climate targets, so that together, collectively, in a global collective effort, the only of its kind around the world, that we can look at tackling the climate crisis. And since becoming MP, as mentioned, I'm privileged to have been appointed as the Liberal Democrat spokesperson on climate and energy. So that's the energy security and net zero. My first day was up alongside Ed Miliband. I hadn't expected that to happen, but what a privilege as well to actually be working there saying, yes, and we can do more. We support you, and we need to go further. And so I was delighted to, take up that appointment on behalf and speaking up on behalf of the people in South Cambridgeshire, but also, as I say, kind of holding the government to account and supporting them to make some of these difficult decisions for that action on climate, but also advocating for a just and fair transition, because a lot of my work has been working with some of the poorest communities in some of the most climate-affected, hit countries around the world. And I know that we can only do this transition when we take people with us and ensure that their livelihoods are cared for. So as well as clean power, which is the transformation which this government is really pushing forward on, as Liberal Democrats, we have also been advocating for warm homes now. Yes, we need to push forward with renewable and clean energy, but warm homes now. An emergency home insulation programme this winter so that we can winter-proof the NHS, and particularly for those most vulnerable who are having to make that decision with last week being announced, once again, a rise in the energy price cap, having to take difficult decisions between heating and eating. And it's noteworthy that today is Fuel Poverty Awareness Day. I asked last week for information from the House of Commons Research for the situation in terms of fuel poverty in the UK. 3.17 million households in 2023 are in fuel poverty, with the health variance that means in terms of their quality of life, their educational achievement and attainment, making these decisions. Fuel poverty means you have to make a decision in terms of your budget between eating and heating. That's basically the definition. And in terms of Cambridgeshire, we have seen over the last 5 years a rise in the total number of households with children that are facing fuel poverty. And research has been shown that attainment by those children at school after being cold at night is dramatically impacted. So we need to, not only the government will launch its Warm Home Plan next spring, but I'm pushing them to winter-proof this winter and to therefore reduce the strain on the NHS too. So as I've said, I believe that the global crisis facing our public health systems around the world is inextricably linked to climate change. And so therefore, from the centres of decision-making in Westminster, across the globe, to community empowerment at local and regional levels, we've got to face up to these huge and immediate challenges which the triple crisis of climate, nature, and health pose to us. And the impasse over collective health and climate action, it just can't be pushed further down the road. And it was one of the reasons that I decided to stand nationally, to stand for Parliament. Because as a result of the last government's rowing back on climate policies, the National Committee on Climate Change has recently stated that we are off track in meeting our own climate pledges, despite 2023 and meeting our previous 3 carbon budgets as set out. We are the only industrialised nation to have set our net zero targets nationally in line with that net zero ambition of 2050, and we've met our first 3 carbon budgets. And in 2023, we had the greatest reduction in our carbon emissions. But because we've only got a third of the emissions reduction needed between now and 2030 and 2050, we are completely off track. So we absolutely need to get back in track on those. And the recently published Lancet Countdown on Health and Climate Change was a timely summary of the increase in the life-threatening weather events that are a consequence of this. New waves of disease, contamination, and famine that our global health systems are woefully unprepared for. And the Lancet report describes the issues we're dealing with as compounding and cascading. They've found that the extreme weather events that are happening are costing our economies more than ever before in an age of ever-increasing healthcare spending. And on top of this, productivity is being impacted by climate change too, and working people stretched further, creating yet another strain on the health service. What the report shows is that globally in 2023, people were exposed to, on average, an unprecedented 50 more days of health-threatening temperatures than expected without climate change. Extreme droughts affected 48% of global land surface, and 61% of global land area saw an increase in extreme precipitation, rains and storms and floods, increasing also risks of food insecurity and water contamination. In 2022, the European heat wave is estimated to have resulted in over 60,000 heat-related premature deaths that cannot be explained otherwise than due to the heat wave. And with ongoing climate warming, the climate projections for Europe suggest a progressive reduction in cold-related deaths, our flus, our pneumonia, and colds, and a simultaneous increase in heat-related deaths, with a 2021 study indicated that heat-related deaths have started to exceed reductions in cold-related deaths. So we need action urgently. And to be on track for net zero emissions by 2050, as we've seen at the Global Climate Summits, global clean energy investment has to triple by 2030. We have to double energy efficiency, and we have to reduce fossil fuel investment, more than half its current value. Now, just last week, as the Liberal Democrat spokesperson for climate and energy, I was at the Global Climate Summit in Baku, Azerbaijan, COP29. And a final deal was struck 33 hours after the official closing was supposed to happen, at the 11th hour of negotiations, or what I see as the 11th hour for our planet. It wasn't a deal that satisfies everyone. At one point, developing nations, especially those facing the most severe climate impacts, walked out. That was on the last day. They were brought in finally around what is the new climate finance deal, where we're recognizing our responsibility to those countries that have little to do in terms of increasing global warming, but they are facing all of the impacts. Now, during the COPs, the Conference of the Parties, every year now there is a health and climate day. So each day is themed, and there is a climate and health day. And this year we heard from Maria Neira, who's the Director for Public Health and Environment at the World Health Organization. And what she provided was evidence how climate change is creating the ideal conditions for disease to spread. So we're looking at COVID, at pandemics, we're looking at ticks, malaria, lupins, all of these diseases which were mainly seasonal, vector-borne diseases, are now no longer seasonal. They're concurrent throughout the year. And this is proving hugely challenging and showing that now these will be interconnected global challenges. She also highlighted how climate change is creating the ideal conditions for displacement of peoples into camps and into conditions where disease will be rampant, as I've seen in many of the refugee camps. And this challenge may be evolving, but it's not, because we've had decades of inaction, and this has been affecting people worldwide. I feel it's shameful that actually we've waited so long to get to the level that we have in the climate negotiations. It's until these climate shocks are at the doors of our developed nations that we are being more ambitious in terms of our climate agreements. That should have happened much, much, much sooner. My involvement in climate change began back in the 90s, where I spent about 20 years. I was out in East Africa, in South America, the Caribbean and Central America. And I went out in terms of teacher training in education. But what I found was children that were being impacted, young people impacted by climate change, devastating crops, increasing water contamination. The bacterial load that they had meant that they were suffering from anemia. Malaria was killing more than one child in every family. And I thought, well, to be able to get to the level where they can concentrate in the education they desperately care for and want, and is their opportunity in life, we have to look at what those standards are, how we deal with our natural resources, how we combat climate change. And that was the transformational part for me in terms of working. And then after years of working with these local communities and governments, seeing coastal infrastructure battered, crops devastated, families displaced, diseases raged, children's education disrupted, it was a huge privilege, and I became the policy lead for DEFRA and DFID's largest climate policy program for developing countries. And I've carried through the insights I've gained from that now into the world of politics. This programme worked across the world, and I think one of the most impactful and insightful programmes was the analysis carried out by an Oxford-based think tank with this funding on the Indian heatwave, which killed thousands of people in Delhi, thousands. And what we could see was that people's lives were being lost. They were avoidable deaths. They were avoidable deaths if government decisions and policies and departmental decisions had been different. What we were finding was people who were in public sector jobs or in businesses, or this was traffic wardens, police, factory workers, agricultural workers working out in the field, in over 40 degrees temperatures, were working more than 8 hours with no shade, no cover. When they collapsed, the ambulances, the places that they were parked, were not parked strategically in any way where there could be these vulnerable hotspots. So by the time the ambulances reached these people who'd collapsed from heat wave, it was a long time. But the killer blow was when they took them to the hospitals that had black roofs, and they were put in the oven, and that was the end. The place where they should have been cared for and helped to recover actually finished them off. This was just about infrastructure, working conditions, and policies. And climate change is no longer an issue for just the global south alone to face. So in the UK, we're feeling the effects firsthand now. And this is where I'm really interested, because government departments are woefully unprepared here in our country. I'm a member of the Environmental Audit Committee, one of the select committees that scrutinises all government departments in terms of their environmental preparedness. The latest 5-year independent UK climate risk assessment report for the UK has shown that, as well as affecting health burdens on the health and social care system, climate change will disrupt assets and services directly through the impacts of floods, heat waves and other extreme weather on hospitals, health and social care settings, and as well as the buildings and infrastructure on which they rely. It's been estimated in that UK climate risk impact report that up to 90% of hospital wards are at risk from overheating. That's here in our country, due to their design, while 10% of UK hospitals are located in areas of significant flood risk. So during the summer of 2020, for example, here in the UK, an additional 2,500 deaths were recorded during the heat wave, which cannot be explained by other factors. And it's estimated that UK heat-related deaths could triple by the 2050s. And while there's more and more evidence always about the risks of overheating in homes and our hospitals and our surgeries, policies to protect people from overheating in new and existing homes are still to be developed. And we're looking at the future homes building standards only still to be coming in 2025. That means planning committees across the country, of which I was chair in our local South Cambridgeshire District Council. We cannot yet oblige developers to have the energy efficiency standards and the ventilation standards necessary, because there is a national threshold that we're not allowed to go above. Absolutely disgraceful. So we have to change that. And we also know that this infrastructure is at risk of flooding. And flooding also has profound impacts on the people who experience it. So not just the physical infrastructure, but as well as a small number of annual deaths or injuries, there's growing evidence of long-term and severe impacts on the mental health and well-being from flooding, due to damage to property, including upheaval, financial implications of cleaning up, disrupted access to employment, education, health services and wider facilities, and illnesses from waterborne pathogens or chemical contaminants arising from floods. This is now here. I was looking way back then at Delhi, and we're now looking here at the UK. And the magnitude of risk is classified as high now and in the future for all 4 nations of the UK. So as the Environmental Audit Committee, what we've asked from the National Audit Office is to do an audit of the health department and other departments across government to say in what way are risks being factored into government budgets and planning, because I think it's absolutely critical. And the NOA, their first response back is that it's a box-ticking exercise at the most. So it's how we can, with financial limitations, budget constraints, but make sure we're factoring in this at all levels. And to compound this issue, obviously hospital and care facilities are incredibly energy intensive, so we need to retrofit and we need to remodel sites to reduce our emissions and mitigate against climate change. So the challenges we face are not only in putting forward foolproof, evidence-based research on climate and health, it's also critical how we frame our arguments, the way that we talk to people about the measures that we need to take in place to solve these twin crises, because it's the only valid option for us to pursue as government and as organisations. Public opinion has a considerable influence on government response to climate change. So recent evidence cited in that same Lancet report suggests that a health framing of climate change can bolster public support for mitigation policies and enhance people's intentions to advocate for climate solutions. But an analysis that was done of X, formerly Twitter, shows that even though there's more mention of climate change in posts, there's very little appreciation of climate health nexus issues in what people are posting. So given the potential for health framing to strengthen public and political support for ambitious climate policies, we need to foster and work together to create better awareness of this. And I think it's his role for us as politicians and influencers and for everyone in this room too. And our focus has to be on the positive arguments we can collectively put forward that working on climate change is better for our health, better for our NHS, better for public health globally. The hope instilled by the Paris Conference, Paris Agreement in 2015 was a flicker of success, but it's been met by dangerous ideological barriers and culture wedge divisions, despite the scale of the challenge we face ramping up. But I believe the response is not to reduce our argument to the same level, blaming someone else, closing ourselves off to each other. We know from past lessons of integration, we know from across the world that collectively we're stronger together. And as a cooperative international order, globally, we can work towards a better future, irrespective of borders or differences of opinion. And climate does not respect any borders. And I've consistently advocated for a closer relationship with our European partners, because that is where we can also fight together for our health policies and globally. So I hope we can continue and strengthen internationalism, strengthening the role of the UN, strengthening the role of the World Health Organizations and multilaterals. And as part of the Conference of the Parties in Baku, Azerbaijan last week, I presented to others as an example what we will be taking to Parliament, which is a new climate and nature bill, which shows, and it will be introduced in January to Parliament. This is looking at the twin crises and the fact that we need to look at both of these together to address our public health problems and also to tackle the climate change crisis, because we cannot tackle climate change without nature to absorb the carbon and to help us adapt to floods and droughts, heat waves. But also climate change is the hugest threat to biodiversity that we have here. So I think that the Lancet's call for putting human health at the centre of climate change finance and policy, it's not only an essential requirement for international policies to be sustainable, but it's also an effective way to frame the issue in order to build greater support by putting the human cost across all nations at the front line. And you, in all of our health sector, are at the front line whenever these disasters hit. And so it's also with you and through you that we can together fight this battle. And it can't be solved by top-down government intervention. I've seen that across the world and also here. We have to empower communities from the individual level upwards. We can't just push down. Agency is key to mental health, as was found by a report on children's climate anxiety, 10,000 young people between 18 and 24 across 10 countries. And they are frightened, they are anxious, they are angry. But the real reasons they said why they are two reasons. One, they don't believe that decision makers are listening to them. And two, they don't believe that decision makers are making the right decisions around climate change for their future. And therefore, they feel they don't have agency. And that agency is absolutely critical to mental health. And that's why I champion the work in South Cambridgeshire. We have incredible sustainability groups in villages, Sustainable Shepworth, Halton and Haslingfield Eco Group, thank you. We have all of the different river action groups. We have the Melbourne Health Hub, all of these community actions where people are empowered to be doing things differently to contribute towards solutions. And I put that again at forefront of my maiden speech in Parliament with a call for what we need is a framework between the national and local government. We have research that shows that if we tackle climate change through local authorities together with local communities, not only will that be 400 million worth of savings, it would also be 600 million in terms of co-benefits. So we can work together. Local authorities are responsible for about 60% of our carbon emissions. So working together, health and local authorities will be critical. So it's not our job to tell other nations what to do, it's to set standards, to set that leadership. And so I can't talk about setting example without referring back, as we heard from the welcome words as well, is the incredible work being done right here in Cambridgeshire, which stands as a beacon of innovation, often working together between the public and business and private industry to develop groundbreaking research on global public health and innovation. So we have, in my constituency, world-leading science and technology developments, such as the Cambridge Biomedical Campus, the Wellcome Genome Campus, and others across the whole of Cambridgeshire. I've previously called on the government to acknowledge just how important the industries of life science and tech are. I'm part of the All-Party Parliamentary Group. I'm an officer, vice chair of the All-Party Parliamentary Group on Life Sciences, where we hope to link that again with global public health. They help shape the future here in the east of England and internationally, and an excellent example of how working in partnership can be so effective. Climate change, in conclusion, has always been a health issue, and we've allowed it to become an existential threat for far too many people. Despite the range of challenges I've laid out and that we know face ahead of us, I remain hopeful for the future. Having spent most of my life witnessing the incredible determination at all levels and across so many countries, I know that collectively we can build a healthier world to hand on to future generations. I hope there's an elected representative in the east of England. I can stand beside you and offer hope and ambition and a lot of hard work. And I wish all of you delegates the best in your efforts across the range of fields that was represented here today for that better future. Thank you.